friend of mine in the USA told me a story about her dad. In his 70s, he developed abdominal pain and weight loss, and a CT scan showed the worst possible news. He had advanced bowel cancer. He returned from the operating room in less than an hour. The surgeon was grim. "I'm so sorry," he said. "I need to tell your dad that he has advanced cancer and he only has 3 to 4 months to survive." My friend said, "No, doctor, that's not what my father needs. You're going to tell him that the operation was a complete success and he has nothing else to worry about." She is very persuasive. The surgeon reluctantly agreed. Her dad went home to die without medical treatment and survived for 9 years. This story of unexpected and miraculous survival is actually not that uncommon, as a research group in the USA has uncovered 3,500 fully documented case reports of spontaneous remission hidden among the papers in all the many medical journals around the world. In our rush to adopt all the technologies of medicine, we've forgotten that it's the patient's capacity to heal that leads to healing and recovery, very often more than the treatment we give. So when a patient comes to the hospital with a broken leg, the surgeon can fix the bones together with screws and plates, but the bone has to heal itself. And when a bowel surgeon cuts a tumour out of the bowel and stitches the end together with sutures, in a week's time you wouldn't be able to find the joint in the bowel heals itself. So patients have this extraordinary human capacity for healing, and they heal the best when they really believe in the doctor and in the treatment. The converse to that is that we're learning more and more that it's actually emotional suffering that's a cause of disease. For instance, a study in the Netherlands followed 1,000 patients who'd survived a heart attack. In the course of cardiac rehab, they did a psychological evaluation, and they were divided into 3 groups: the optimists, the middle group, and the pessimists. And they followed up for 15 years to find out who survived, who died, who had a heart attack, who had a stroke. And they showed that the optimists had, for cardiac causes disease, 1/4 mortality rate compared to the pessimists. A similar study showed that in volunteers, if you infected them, if you put influenza virus into the nose and throat, that the optimists were 1/3 as likely to get clinical influenza compared to the pessimists. And recent studies shown that work stress, burnout, is a very potent cause of disease. So for instance, if you're above the threshold for the burnout score, you have a 40% increase of having a heart attack or stroke in the next 5 years. And that's a bigger risk factor than being a smoker or having high cholesterol. So how does this relate to our compassionate caring? What we know from research is that when we bring kindness and caring and compassion to our patients, we actually elicit a very powerful physical response. Genes are turned on, new proteins are synthesized, healing is enhanced, the immune system is bolstered, dangerous stress responses are dampened down, and patients recover quicker and get better outcomes. So the meaning of healing is to transcend suffering, and the meaning of compassion is the humane response to suffering. So it's our compassionate caring that triggers that healing response and allows our patient to recover better. So how have I learned to apply that in my own clinical practice? Well, for most of my career, I was very skilled at setting the agenda for patient care. I was the expert. I trained for 14 years to become an anesthesiologist. I thought it was my job to make decisions about patients' care. Now I practice in a very different way. What I do is I build trust and rapport with every single patient, and I find out what's most important to them, what their concerns are. Then I bring my knowledge, skills, and resources in the service of the patient's life. My patient sets the agenda for care. And relating to patients in that way, that's the thing that builds their trust, their rapport, that elicits the healing response and gets much better outcomes for your patients. In our busy and overstretched healthcare services, we tend to perceive our patients as a burden of demand upon our services. But if we learn to bring our compassionate caring in the service of the patient's own life, of their own priorities, we trigger that healing response, and we discover that our patients are not a burden on our services. They're our most abundant resource of health, healing, strength, resilience, and well-being. And there's research that shows this really powerfully. For instance, a study of anesthesiologists at a Harvard hospital showed that if anesthesiologists related to the patient in the pre-op period for just a few minutes in a positive, caring, supportive manner, that halved the dose of morphine the patients used in the 5 days after surgery, and it substantially reduced the length of their hospital stay. There's also research to show a meta-analysis of all the best trials showing what happens if we invest in the doctor-patient relationship. How much can that influence patient outcomes? And that shows that if you have cardiovascular risk factors, having a doctor who cares for you, that reduces your 5-year risk of a heart attack more than being prescribed a statin and a cholesterol-lowering drug. So each day as we come to work, we really have to remember our deeper purpose, that of being a healer. We need to bring our hearts to work. We don't just need to care for our patients, but we need to care about our patients. Our compassionate caring is the most powerful thing that can elicit that healing response that gets better outcomes for the patients, higher satisfaction, gives us meaning and joy in our work, and can substantially reduce the cost of care.